Hello everyone, myself Ruchi Patel, working as an assistant professor at LJ College of Physiotherapy. Today I am going to take second year topic, that is the knee complex. And in the knee complex, we are going to learn about the ligaments. In previous lecture, we have studied about the collateral ligament. And in today's lecture, we are going to see about the cruciate ligament. As we all know, that collateral ligaments are the medial collateral ligaments and lateral collateral ligaments. And the details of both the ligaments already we have studied in the last lecture. So today we'll start it with the cruciate ligaments. As we all know, there are mainly two cruciate ligaments, anterior cruciate ligament and posterior cruciate ligament. So anterior cruciate ligament is attached distally to the tibia on the lateral and anterior aspect of the medial intercondylar tibial spine, and it extends superiorly, laterally and posteriorly to attach the posterior medial aspect of the lateral femoral condyle. I'll show you with this diagram. Here you all can see this is the knee complex, the lateral side, this is the lateral collateral ligament, medial side, medial collateral ligament. Here, this in the anteriorly, you can see the anterior cruciate ligament, and posteriorly, posterior cruciate ligaments are present. So first we'll see the ACL attachment. So ACL attachment is it starts from the anterior direction. So it is present on the lateral aspect of the medial medial condyle of the medial tibial plateau, or we can say it is present in between the intercondylar space. Okay, so it then extends in the upward and in the posterior direction, and it goes in the posterior direction, which get attached to the posterior medial aspect of the lateral condyle, lateral femoral condyle. So it starts or it's present from the anteriorly, which is present near to the intercondylar space. It moves upward and posterior direction, attached to the posterior direction, correct? So it attached to the posterior medial aspect of the lateral condyle. Okay, so it has a two fibers, anterior medial and posterior lateral. So the blood supply to this ACL are the genicular artery. Okay, medial genicular artery. Then anterior cruciate ligament function, as we all know, that help us to restrain the excessive anterior translation of the tibia on femur. So whenever the excessive tibial anterior translation is occurring, it will be controlled by the ACL. And this role, however, is attributed to either the anterior medial bundle or posterior lateral bundle, depending on the position of the knee joint flexion angle. Okay, so in the intact joint, the forces producing an anterior translation of the tibia on the femur will result in a maximum tibial exertion at about 30 degrees of the flexion, when neither the anterior or the posterior lateral bundles are tensed. So the maximum chances for the anterior translation of the tibia will be more during the 30 degree of the knee flexion, because here neither the anterior medial nor posterior lateral fibers are tensed. So in contrast, this appears to be essentially no anterior translation of the tibia possible if the full extension when the many of the supporting passive structures will get taut. So here the ACL as well as other structures which are supporting to the knee complex will get tensed or will get tightened, and in this way during the uh, knee extension, there will be the less chances for the excessive anterior translation of the tibia. And the anterior cruciate ligament is also responsible for resisting the hyperextension of the knee. So whenever the hyperextension of the knee, excessive hyperextension of the knee is seen, we should check for the ACL, uh, the position, or we can check for the ACL whether it is a tear or whether any damages are present or not. Okay, so in addition to its primary role of the resisting excessive anterior translation, it also helps to provide the medial and lateral rotational stability. Okay, so we can say valgus and varus angulation control and medial and lateral rotation control will also be provided by the ACL. Okay, so next, so although the anterior cruciate ligament may not make an important contribution to limiting the medial rotation of the tibia, the medial rotation of the tibia on the femur increases the strain on the anterior medial bundle of the anterior cruciate ligament, with the peak strain occurring during the 10 to 15 degree of the knee flexion. Okay, so this suggests that it also helps for the medial rotation control. So regardless of the rotational effects on the anterior cruciate ligaments loading pattern, injuries to the anterior cruciate ligament appears to be a most common injury in the knee joint, especially for the sports person, because the rotational motion along with the flexion motion is occurring during this twisting motion, and that can cause the tear in the ACL. Okay, so whenever the person is giving weight on the leg, an excessive rotational movement is occurring, that time the chances for the ACL damage will be more. Then the scientists Fleming and their colleagues reported that the some muscles which help us for the for the support to the ligament. So whenever these ligaments are not giving their 100% to control the motion, these muscles are also somewhat helping to them, and some muscles are in a such a way that increases the strain or that increases the workload on this ACL ligament. So with this we can say the ligament, the muscles which are present in the knee complex, the surrounding to the knee joints, are capable of either inducing or minimizing the strain in the anterior cruciate ligament. With the tibiofemoral joint in the full extension, the isolated quadriceps muscle contraction that is capable to generate an anterior shear force on the tibia, and thereby the increasing the strain on the anterior cruciate ligament. Okay, so quadriceps will increase the strain on the cruciate ligament. The same way, the gastrocnemius muscle also has ability to translate the tibia in the anterior direction, and as a result it can strain the anterior cruciate ligament. Okay, because of the its attachment which is near to the tibia, so this can pull the tibia in the anterior direction. Opposite to these two muscle, the hamstring muscle has ability to take the tibia in the posterior direction. So it it causes the posterior shear, and as a result, it helps the ACL injury person. So whenever the ACL injury is occurring, and if this hamstring is getting activated, it helps to control the knee position, or it helps to avoid the excessive anterior translation. Okay, so along with this hamstring muscle, soleus muscle also have the ability to produce the posterior translation of the tibia and to assist the anterior cruciate ligament in restraining the anterior translation. In the same way, the posterior cruciate ligament also we have. The posterior cruciate ligament, it starts or it is attached uh, in the posterior direction, that is on the posterior medial aspect of the lateral condyle. It runs anteriorly and it attached to the medial aspect of the lateral condyle or in the surface of the intercondyle. Okay, so posterior cruciate ligaments attaches distally to the posterior tibial surface between the posterior horn or between the two menisci, and travels superiorly and somewhat anteriorly to attach the lateral aspect of the medial femoral condyle. Okay, so here you all can see this will travel in the anterior direction and to attach the medial femoral condyle. Okay, so it attached to the medial femoral condyle. The posterior cruciate ligament is a shortened and it is less oblique structures than the anterior cruciate ligament. Okay, so again we'll repeat the position. The posterior cruciate ligament, which is attaches distally to the posterior tibial surface between the posterior horn of the two menisci. It runs superiorly and in the posterior direction, and it attach, and we can say somewhat in the anterior direction, and will get attached to the lateral aspect of the medial femoral condyle. Okay, so even it has a two fibers, same like the ACL. It has a anterior lateral and posterior medial fibers. So here by mistake I have written ACL, but it's a PCL fibers. So anterior lateral, posterior medial fibers. Okay. So when the knee is in the closed full extension, the larger and shorter anterior lateral bundle is lax. So the most of the burden will come on the posterior medial bundles. Okay. So same like anterior cruciate ligament, some muscles will help or some muscle will assist the PCL, and some muscle will increases the strain on the PCL. So popliteus muscle will shares the role of the posterior cruciate ligament in resisting the posterior directed forces, correct? And it helps to provide the stability. In contrast to this popliteal muscle, the hamstring muscle contraction will also cause the posterior translation, and it increases the strain on the PCL. The same way, gastrocnemius muscle also causes the posterior strain or excessive posterior tibial translation after the 40 degree of the knee flexion range. Okay. So this is all about the brief idea related to the ACL and PCL. For the further detail, you all can refer the Joint Structure and Function by Cynthia Norkin. Thank you.